Okay, so welcome again. We are, uh, all of you address my question of the day. What is your favorite fast food meal and why? I was able to address some of your questions. I'm going to lecture on program evaluation just briefly, and also the matrix and changes and measurements that you're going to work on your final workbook assignment that is actually going to lead you to the final assignments for the semester. So all of you are doing great. Like I said, we're going to have everything kind of builds up your organization or organization culture, the technology assessment. So technology assessment is actually going to become a little bit more robust as you do the last two, especially the last assignment on measurement and metrics. Those of you who also already had program evaluation, it may be a little bit of a review. Those of you who did not have any kind of program evaluation or program evaluation theory, this is just a introduction. I'm not going to cover in depth the program evaluation theories or all the definitions, but give you enough for you to get an idea of what we're trying to do, because it's always part of every grant application that you actually submit for any kind of funding. And then we're going to go into small groups after our break. So anyway, program evaluation. So this is one of my favorite subjects, just because it brings all the numbers and words to life. And for me as a public health professional, what we like to do is to ensure that any kind of campaign, programs, things that we are running is effective. So in a nutshell, so if you were to talk to, let's say, middle school kids, if they ask you, what is program evaluation? Simply what it is, it provides evidence of what works. It helps with decision making, improves programs, and help meet organization goals. So it doesn't have to be in education. It could be in every single sector. You also have to understand the internal and external factors influencing the success. So the program evaluation is very different from, let's say, from a industry versus government to higher education to military, etc. Because there are different types of program evaluations and different metrics or measures that you're going to measure. So what does that mean? So if you go into program evaluation, you can get a PhD in program evaluation if you wanted to. So the quick overview of program evaluation. So those of you who are program evaluation, interested in doing program evaluation, or if you're teachers or managers or leaders, you're constantly doing program evaluation, whether or not you know that you're doing it or you're consciously doing it. So there's formative evaluation, process evaluation, summative evaluation, impact evaluation, and outcome evaluation, and developmental evaluation. So there are different types of evaluation, and you could be hired to do evaluation at any point in their process, and also either beginning or at the end of different projects. So what does that mean? When I talk about formative evaluation, and like I said, this is just a quick overview. If you're not understanding it all, don't worry. This class is not an evaluation class. However, like anything, like numbers and words, evaluation is actually part of everything that we do. So it's conducted during program development, so formative years. So if you think of childhood and formative years, you're coming in during program development. So you're trying to start a program to improve its design and ensure it works effectively before implementation. So hopefully this is where all of you are coming in with the adoption of learning technology. But a lot of times for me, my experience with program evaluation, a lot of times I get hired to look at health programs for their accreditation, or I look at their toolkits for deploying it out to different communities to make sure that it's addressing the audience. So that is after the fact, right? And then also during. So process evaluation is examining how the program is being implemented. So formative is you're starting in the beginning as the planning stages. Sometimes process evaluation is as the program is already off the ground, you are coming in and seeing how it works. Usually it's focusing on operation and also identifying the areas for adjustment. And that's one of the reasons why I asked you to kind of look at your organization culture, technology implementation and assessment, as well as doing the SWOT analysis to get a feel for what's the internal and external factors that are working within the organization. The other one is summative evaluation. So think of summation, right? It's overall effectiveness after the program has been completed, especially focusing on outcome and impact. So this is what a lot of you do. A lot of times grant funders want to know what is the outcome, what is the impact. So it's the summation of everything at the end of the program. After the implementation, we are looking at the effectiveness. The impact evaluation, it looks at the broader effects of the program, such as hard to measure, right? Changes in knowledge, behavior, or public health outcomes. So what is the impact? Meaning, do they change the behaviors? Are they smoking less? Are they engaged in less risky sexual behaviors or drug behaviors, etc.? And what are some public health outcomes? Meaning, are more people taking vaccinations before the flu season or during flu season? And then specifically, we're looking at outcome evaluation. So we're looking at specific results achieved compared to program's goals. So this is why your mission, vision, and strategic plan of your organization is really important, because the outcome evaluation is focusing on specific results. And then you also have developmental evaluation, which is new in terms of it's used in technology or companies that are doing a lot of cutting edge stuff. I'm sure Elon Musk is doing all of these because he is doing a lot of great stuff for the space exploration. Maybe we will go to Mars during our lifetime. So we're using innovative or evolving programs to look at the continuous learning and adaptation throughout the process. So there are different types of evaluations. So a lot of times, most people will tell you about these three. These are the most popular ones that people talk about: formative, process, and summative. But if you go deeper into the evaluation process, there are different types of evaluation that you look at. We do have courses in evaluation and evaluation theory that runs during the year, where you take theory, then you take evaluation to learn how to do all this. So you're asking, okay, all these terms are great. Some of you have done evaluations before, so you may know some of the terminologies. Some of you may have never done evaluation. Those of you who are teachers, you're doing it all the time, but still sometimes, a lot of times there's not a name next to it. So give me just a second. So I'm going to pause. So and I like to give you my public health perspective, just because if I use education example or some other examples, it may overlap with some of the projects that you're working on too directly. Public health is more population based, and then of course we had the pandemic, so I can talk about it in length, in context. So Formative evaluation. So remember the example that I told you about public health and the work that I'm doing right now with AI and trying to figure out how do you implement AI in the workforce. So one of the things that we're looking at is the CDC, Centers for Disease Control and Prevention, not Child Development Center, um, is that how do you use AI to predict diseases? So, for instance, infectious diseases. One of the things that I ran into issue as a state epidemiologist is the fact that not all the data collections were talking to each other. So, if there was a mass student absence in one particular school, and there was an outbreak of, let's say, meningitis, for instance, I wouldn't connect those two together because they're student absentees and then disease tracker are not really talking to each other. So right now, there's a capability of drawing all these different disparate or separate databases that normally don't talk to each other and be able to do a disease prediction model. Another thing that we saw during the pandemic was the fact that looking at social media posts, we're able to actually predict the outbreak of a certain flu or COVID, for instance, about a week or two before we are able to detect it in our data by just looking at people's symptoms and the words that they're using. So AI uses natural processing language, right? So there's different ways to use that. So formative evaluation, we want to test the system with a small data set to make sure that it integrates well, it is working with the existing system and aligns with public health goals, okay, at a particular department. So what is a process evaluation? So once, let's say for process evaluation, we want to see how AI is being integrated in daily workflows. So the process, we're assuming that the AI is already implemented and we're looking at what workflow. So the epidemiologists or people who are doing contact tracing are going out there. Are they more efficient because they have these tablets that show where these spikes are and assessing how often healthcare use it and whether or not training is effective. So that's process evaluation. This is after we're assuming that the AI, some aspect of AI got incorporated into the public health system. So summative evaluation, usually you need to have a certain period to look at and collect the data. This evaluation checks if AI tool reduce the diagnosis time. So let's say in order to investigate meningitis or norovirus or any kind of all these foodborne disease viruses, etc., in the field, we want to see if there's a reduced diagnosis time. So we're able to identify the patients or clients and be able to get them to different healthcare areas. We also look at response accuracy and also comparing the results from before the AI was implemented and also after the AI was implemented. So this is all assuming that data is being collected. So as all of you know, working in different industries, not everything is collected. So, so this isn't a perfect world where everything is available. So this is all talking in terms of theory. So impact evaluation. So what does that mean in terms of infusing AI or integrating AI into the public health system? So over a longer period of time, we're trying to see the infection rates. Do they persist? Like, are they down? And we're also looking at public health outcomes, meaning there may be some measures that we're going to look at that would also reliably also show that reduce infection rates also improve public health outcomes, such as lowering of the spread of communicable diseases. So we have less foodborne diseases or less of certain diseases in certain areas when we know that there's a steady level of certain diseases in the area. And then in terms of outcome evaluation is very straightforward. So it's measures a specific results. So for example, AI tool achieve its target improving diagnostic accuracy by 20% and reduce the time by 30%. So when we do outcome evaluation, you're usually putting either percentages or specific numbers by a certain time to show that the outcome actually met the expectation. The developmental evaluation. So AI tool, it's still cutting edge. It's only been in the market for the public for the last 2 years or less than 2 years since it came out. OpenAI came out with it in November of 2022, I believe. So this tool, this evaluation is going to help based on real-time feedback, such as going back and tweaking based on the new epidemiological data or adjusting new protocols depending on the AI diagnostics. So meaning we can look at different response times, different measures to see whether or not we are getting faster, because as you know, AI learns from us and vice versa. The more data that you put in, the AI is able to train on itself for accuracy, and also it has different layers. So how do you do this? So let's say you're an evaluator coming in, or the grant funder want to know, if I'm going to give you $500,000, is it really worth my money, right? So we can talk about all these wonderful things and what can happen and what kind of evaluations that we can do. However, the last assignment of the worksheet that you're working on, as you think about your company, what you're trying to achieve, is evaluation metrics, meaning you need to have specific criteria used to measure success or impact of a program and initiative. Meaning we could have same technology going into different industry. The metrics in which you're going to say it's successful or impactful is going to be very, very different for different industries and different organizations. So what does that mean? Well, you have to, like I said, know your program really well, know the initiatives pretty well. And all of you did a great job on the SWOT analysis, mentioning about what are some of the uphill battles that you have to fight within your organization and outside of your organization. I think all of you mentioned leadership was one of the factors that you have to look at. So in the business world, as well as anytime you're looking for money, doesn't matter if you're coming from sociology or English or whatever, humanities, people want to know what are your key performance indicators. So especially if you are introducing a technology or learning technology or something novel that you are trying to introduce to your organization, you want to know what the key performance indicators are. So these are more focused, quantifiable measures that can track progress towards a specific goal. So those of you who are doing things in, let's say, accounting office, or those of you who are working in industries where numbers are the way they quantify, it's going to be a little bit easier for you just because they're collecting that data in numbers and you can crunch it. Those of you who are in industries where they're using words, you have to be very careful because you have to show that something has improved over time, but you need to be able to show before and after, meaning how much has it improved, and you have to have some kind of measure for it. So how do you do this? You probably heard of SMART goals before, and all the KPIs should be SMART, meaning very specific. It should be measurable. It should be achievable, relevant, and time bound. So You probably heard of this before, and those of you who probably at least one or two people on a diet saying, I'm going to lose weight, right? Um, and it's not the best goal because we don't know specifically, right? Measurable, we could do it by a lot of different ways, right? Looking at your weight in pounds. You can also look at your BMI, body mass index. You can also look at your percentage fat, percentage body muscles, right? Or the ratio of different things. So you need to be very specific, meaning there, even though you have numbers, you need to think about, okay, if it's a measure that you're going to track, is it relevant, achievable, and time bound? So um, me being a nutritionist in my past life, the sustainable weight loss that you can keep it off is 1 to 2 pounds. If that is the case, if someone said, I'm going to lose about, 80 pounds in 4 weeks, it's going to be not achievable, right? So unless you are planning on getting a gastric bypass, that's not going to be possible. So you want to make sure that it's specific, measurable, achievable, relevant, and time bound, especially if you're asking for money or you're presenting. So give you the example. What do I mean by this, right? So back to the disease um, example of infusing or using AI in public health is the evaluation metrics. Like I said, you can actually look at the accuracy of disease prediction. You can look at the response time and cost savings. There are other metrics that we can use in outbreak investigation. But let's say if we decide to choose these just because they are smart, they are the metrics. So if you are stuck doing your assignment, my advice to you is, what does my company actually collect? Okay, what measures do we collect regularly and what are they used for? Okay. So what does that mean? So accuracy of disease prediction. So those of you who have no knowledge of diseases, no worries, because it is not an epi class. It's not a health class. You're in the School of Education. I just like to talk about it just because now after the pandemic, people actually understand all diseases and examples of diseases people understand. So measure of accurate AI models. So we want to know how accurate is our outbreak models going to predict, let's say, the next pandemic. So there's a huge talk of people, especially in public health and epidemiology world, saying that COVID-19 was not the only pandemic that is coming our way. With the climate changes and genetic factors and changes, there may be another one. So accuracy of disease prediction. So depending on which disease we're looking at, that's what we're looking at. Response time. So we can actually track time to respond to an outbreak after the AI prediction. So AI, after getting all the data that we have collected over the years in the public health department, they could kind of give you a prediction model of, if you deploy out 2 people with, this many years of experience, it's going to take this time to get the outbreak investigation done, for instance. And then cost savings. So meaning, if you are able to do a disease model prediction and be able to talk about response time as well as resources, for example, meaning if I were to actually deploy out maybe one season, so a veteran, let's say people who've been in the field for 15 to 20 years, for example, would they do a better job than sending out someone with 3 or 4 or 5 years of experience? So disease model prediction can actually take into different consideration depending on which variables that you're putting in, right? Cost savings is does it reduce manpower, or does it help with tracking? So the cost saving is going to be wonderful in terms of numbers if you are trying to present this to a funder. So those of you who actually did the cost benefit analysis again in the SWOT analysis, thank you, because it gives you another picture of whether or not, if it's a good metrics to capture when you do this assignment. And so when we're looking at KPIs, so are they the key factors that we are going to performance indicators that we want to capture? So those of you who are in different industries, you may want to capture different indicators. So here we're looking at predictive accuracy, adoption rate, and also outbreak mitigation are some of the key performance indicators that we use in public health or healthcare, for instance. Those of you who are in different industries, that's what you're looking for, because you want to kind of figure out an indicator that is used in your discipline. So, for example, why are we using this? Well, we know that for now, if we look at the predictive accuracy, 90% accuracy is pretty good. So it gives you some numbers to work off of. And then adoption rate, meaning we want 80% of the public health officials using AI tools to be at 80% at 3 months. So it makes it very, very tangible to figure out whether or not you achieve that goal. And then outbreak mitigation, we're trying to track the reduction of numbers of missed outbreaks from historical data. So we are required to report to the CDC in terms of the outbreak. There's certain diseases that you have to report out every week. And then if there is a certain disease, you have to report regardless of when it happens. So by doing that, you're able to track the missed and also successes and give a information. So when you go into your own model and trying to figure out what metrics or what measures are we going to look at to evaluate the success of the program is you want to just make sure that it's realistic. So in this case, a lot of people think AI tools are going to solve everything. It's just a tool. There's going to be another tool that's actually going to be better than AI or enhanced version of AI. Relevancy, meaning does it directly related to public health objectives? So does it relate to your organization objectives and strategic plan, mission, and vision? Is it time bound? Meaning some of you might be saying, okay, we need to do this for a year, but is it really realistic? Are you able to measure in 3 months or 6 months and still see the effect? What are specific goals of the program and the initiative? So you need to go back to your organization and then back to your technical assessment, like why are you trying to convince all these people to adopt your new technology? And what problem are you solving? So all these metrics are great, but you have to put it in the context of why are we doing this? Like why are you asking me for $500,000? So for AI, we're saying we're achieving, we're trying to make sure that public health, the public is safe from infectious diseases. And also, secondly, it costs less. So we can actually employ higher skilled public health with more skill sets to be in the government and actually do a better job using AI. It's more cost effective. It may cost more in upfront, but in the long run, it may actually be one of the solutions to retirement. I told you roughly about half, even more, about 60% of public health officials are actually retiring, so they need to replenish. And what are the key success indicators? Meaning you have to select indicators that show that it was successful. So success to you and I may be very different from those who are giving you funding, as well as those who are affected by using your technology. So going back to our AI scenario with public health. So the target specific outcome, like prediction accuracy, you want to be very, very specific, meaning I could have picked anything else. Oh, that people got better in terms of there was a reduced disease, um, disease burden in the population, but that might not be the best predictor. We want to just see the accuracy of the prediction. We also want to see quantifiable improvements such as accuracy percentages. So indeed, like I said, qualitative data are just as good. But when you talk to policymakers and also those who are giving you funding, they like to see some percentages. And of course, having the qualitative data is going to give you that context that a lot of people are not going to have. So, how do you do this? So, if you're feeling overwhelmed, a lot of times you're N of one or N of two when you called in to do an evaluation. So, what you need to do, of course, initially is what you've done, SWOT analysis. You want to see what the baseline is first, but what we need to do is define the initiative. Right now, the initiative is your goal is to figure out how to get your learning technology or this new technology into the culture or the organization. And what are we evaluating? So we want to see what a success would look like. So some of you, for instance, success would be to, finish out this semester. Some of you, the success would be finishing out this whole program. So both successful, right? When you look at the outcome, finishing this semester successfully, finishing the degree, but the definition of success is very different. So you have to articulate it pretty well. You have to set the evaluation metrics really well. So you want to figure out like system uptime, user adoption rate, cost reduction are some of the popular ones, especially those of you who are trying to convince the new technology uptake as opposed to just an upgrade. One of the things about telehealth, for example, that's the specialty that I'm in, is initially people didn't um, want to adopt it because they're like it's impersonal, etc. But everyone was forced to adopt it during the pandemic. So going back after the pandemic, we're looking at user adoption rate, meaning how many of the doctors and also healthcare providers decide to keep telehealth as part of their repertoire of services that they're going to give. So think about what metrics that you're looking at. You want to develop KPIs, meaning you want to just make sure you have the key performance indicators for the metrics that you're looking at. Are you looking at a percentage? Are you looking at um, a ratio? Are you looking at certain numbers at a certain period? And the other thing that you have to remember is data collection. And that's one of the things that you have to remember when you go into an organization or when you're in an organization, you have to know what data is being collected and analyzed initially. You don't want to reinvent the wheel. If they're already collecting the data, and if you could create a composite, number, much, much better. So meaning the school already collects absentee data, and maybe that's a key indicator of something that you decide to measure. So you want to describe in detail how you're going to collect and analyze the data, including the existing data. You want to keep the burden as low as possible. So in order to have a data-driven continuous improvement, a lot of people say, well, things have improved over the years, but the thing is, show me the data. So, I mean, it's show me the money, right? But in program evaluation, as well as anytime you're asking for money, they want to know, give me the evidence that it works. So describe how data informs change to improve the initiative. So you started in point A, now you're going to go to point B. So this is where you're linking your SWOT analysis and taking action on the opportunity through the metrics that you're going to do deep dive on for that analysis to figure out. Some folks are going to pick some metrics that are not measured over time, and that's going to be a key factor. So the questions that you need to ask yourself is, what existing data are available for the measure that you decide to pick for your organization? And how will we know when the goal has been achieved? So those of you who've been working in your industry for a long time, right now, one of the popular things is visualization of data or dashboards where people, for example, right now, UIW is doing the giving or donating funds for their organization. So what they're going to do, and the blood bank does this really well, is the visual analog of how many people are donating. Let's say your donation mark is 10,000. What they're going to do is every week they're going to show you that barometer of how many people have contributed. So you want to figure out how and when the goal is going to be achieved, and how often are you going to do this measurement of the metrics. Like I said, it's not a program evaluation class. I want you to just think about it, because a lot of times when I come in, when people ask me to come in and ask something like, how do we figure out how well our students are doing? A lot of times we have the measure the graduation rate or the retention rate, but it's not showing the whole story. Maybe there may be some data that you need to collect, such as their background, are they first time being in graduate school or undergrad? All those data are going to be important. And how often do they collect it? Do they collect it each time they come in? Or is there or they're looking at their mood, or there may be some measures that you are looking at that is going to help you to figure out a better measure or a more robust measure when you are evaluating certain questions. Another thing that you have to look at is impact and feasibility. So what external factors might influence this metric? It's all in good where you may have 100 question survey that people were willing to fill out during the pandemic because they were stuck at home, and they were happy to do something different and novel and help out the society because we didn't know what was going to happen. But are they going to fill out the survey now, right? Are they going to devote their time filling out the 100 questions? So you have to look at the feasibility as well as the impact. Are the measures realistic and achievable during the current resources? And that's one of the reasons why I asked you, what is your organization like? Are they in the black or in the red? If they're going through a financial crisis, they're not going to be happy trying to pour all this money into a risky endeavor, meaning all technology, because they improve and they change, it is not a safe bet like bonds or something that is very, very steady. So you need to make sure that it's realistic. So it's very, very important to understand your organization and how will this metric drive the decision making for the future changes. Meaning, you have to look at who is making the decision. I asked you, who is your stakeholder? Who are your decision makers? So, for instance, when I worked with policy or and state officials, they want to know percentages. They want to know how cost effective things are. They want to see some nice graphs that are simple. They don't want to know about, different disease prediction model, etc. They want to know the bottom line. So in order for you to give the right information, is the number that you're collecting very impactful? And what would you do if the metrics, and it happens, that were off track? Are you able to course correct? Are you with a group of people who are going to see it as a failure and then just cut you off? Or are you able to mitigate some of this off track information that you're collecting and make it better? So for instance, a lot of the folks, especially dealing with COVID, people did not know that things are going to shut down, right? So those who were able to pivot into online pretty quickly were able to go back to their own business or do things differently to still make the meet their goals and objectives. Those who were not able to pivot or did not have the resources or not in an industry that you can pivot, they did not survive. So in program evaluation, I think all of you mentioned this too in your SWOT analysis is also soft skills. I don't know why they call it soft skills, but communication. You need to be able to communicate your finding to stakeholders. One of the things about me when I was in graduate school was the fact that, yes, I am great with numbers. I fit the stereotype. Um, and in terms of my disappointment is everyone is able to tell me about what they did in terms of analysis, the steps that they took, whatever, among academics. But when you put them in front of a policymaker or a group of middle schoolers or college students, they're unable to give a simple answer that is going to convince them that what you're doing makes sense. So it's going to be very important to understand the mechanics of what you've done, but also be able to articulate what is the importance of the numbers that you collected and the transparency with the stakeholders. So what I told you, you may actually have an off cycle where everything just went wrong. In theory, everything sounded great, but you realize it was all wrong. Are you able to pivot, be able to buy some time and correct that mistake or course correct to make sure that you're on your way to meet the objectives? You also have to highlight strategies for keeping the stakeholders informed, meaning I told you about the visual analog, the dashboards. Those are wonderful. And that's one of the reasons why that industry is growing leaps and bounds, is because if you're able to create a dashboard for small businesses to big businesses in a way that you can kind of go to the site and be able to see, oh, this is how we're doing. It's easier for decision makers to get all that data and be able to make those decisions. However, like I said, not many people can actually describe that in a way that makes sense. So, for example, in public health, especially in epidemiology, those of you who have studied statistics, we say we're 95% sure, right? That our answers are correct. And one of the things that, or 99%, which is a little bit better, but one of the things that policymakers ask you are like, okay, you're an expert. Why aren't you 100%? Like, why aren't you so sure of your numbers? And that person without any statistical background is not understanding that you're giving a scientifically correct answer, but people who are trying to vote on something that is tens of millions of dollars, if you're only 95% sure, if you do the math, right, you lose out on that 5%, right? So it's going to be very important to understand who your stakeholders are and how to articulate what you're trying to do in a way that makes sense. So conclusion wise, SWOT analysis is so important. So like I said, all of you done an excellent job of kind of telling your stakeholders and everyone on the team where you are in terms of baseline. So summarizing, effective program evaluation uses SWOT analysis, meaning we're able to talk about internal, external factors, what measures that we're looking at. So if you have the pleasure of getting in the formative stages where things are just beginning to start, so those of you who are in a position where you're getting the bids from different vendors and be able to buy time and also be part of that decision-making process, you're able to pick metrics that are going to be meaningful not only to you but also the vendor or the person, the vendor, specifically the learning technology vendor who knows the software or the program really well, to be like, hey, why don't you look at these measures? We are collecting them automatically, etc. And then also working with the organization where they tell you, we already track all this stuff, you can have access to it, etc. So reinforcing the value of data-driven decision is going to be very, very important. I know a lot of people, I've met a lot of decision makers where they tell you, I trust my gut. You don't have to tell me the numbers. So true in the olden days when there were no numbers. We didn't have the supercomputers that we could have in our palm of our hands where you could crunch the data. That right now, we have so much data out there that we are able to make evidence-based decision based on the data. But of course, there's some ethical considerations just because we don't know what data sources are going into a lot of, especially if you're working with AI. So these are some of the things that I wanted to talk to you about. Your last assignment, as you're doing the change assignment, you're also looking at your metrics. What are you going to collect and how meaningful it's going to be? And I also want to emphasize that it is not a program evaluation class. So whatever you decide to pick in terms of your measurement, as long as you have a good reason for it, you don't have to worry. So I'm going to stop.